Now, the COVID-19 pandemic has posed one challenge after another. Just as the vaccination drive has started to pick up, we're now dealing with a new variant. So far, only 6 million adults are fully vaccinated in the country. To check the vaccination rollout program, Health Minister Dr. Joe Phaahla will visit the Chris Baragwanth Hospital in Soweto, and he will also give his weekly update on government's efforts in fighting the pandemic. So for now, let's cross to our reporter Heidi Giokos, who is there to give us, of course, a synopsis of what to expect from the Health Minister. Heidi, good morning to you. I understand that the Minister might have just arrived because that, of course, briefing expected in this hour. But sure, this new variant surely posing a threat there for the Health Ministry.
Yes, certainly. We do understand that the Health Minister has just arrived, and we also understand he is accompanied by his Deputy Minister, together with the MEC of Health in the province. There's a lot going on to my left, but as soon as the briefing is underway, we'll move over to there. But we do understand that, of course, there is this new variant that has been identified in South Africa. However, we have been told not to panic as yet. It seems as though the surveillance that is underway does not indicate that this new variant is driving the third wave. The cases are still very low, and Delta is still dominating in the country. But Tumelo, I must just add that the Health Ministry has a huge task on its hands. Yesterday, the Deputy President, David Mabuza, indicating that by December they're hoping to have vaccinated 40 million people. This is, of course, a new target that has been set by the Deputy President, where previously the Health Ministry indicated that by December they would have hoped to have at least given one dose to at least 30 million South Africans. So we still have about 26 million, just over 26 million to go. Just looking at where we are, we have vaccinated or administered over 13 million vaccines to date. So still a long way to go. It seems as though they have a huge task ahead of them in terms of communicating effectively as to why the vaccine is life-saving and why many should go for the vaccine to reach that herd immunity. So there's a lot to touch on, and we do understand that the Health Minister, Dr. Joe Phaahla, will touch on all of these factors, given the fact that there's a lot going on and our cases might be dropping, but still that does not mean we need to let our guards down. It seems as though the Health Minister is receiving a separate briefing by officials, and then he will move over to the podium to give his briefing that he's expected to give at 8, even though it's 10 past 8 now. He will most likely brief in the next few minutes.
Yeah, surely those briefings usually start on time, but as you mentioned, he's just arrived there. So, Heidi, I'm going to leave it there so that we can, of course, prep in time to cross to that health briefing with Dr. Joe Phaahla, the Health Minister, expected to touch on, of course, their vaccination drive, the challenges they're posed with, the progress that they have made, also some of the confirmed cases they're seeing in the country as of late in the past 24 hours. Some of those we've shared with you right here on eNCA, but also reminding me of the conversation I had with Debbie Bradshaw from the SA Medical Research Council. Say they have a concern with the confirmed number of cases from government side, because that number in terms of deaths might be at least 3 times more than what government has announced. This is due obviously to those who have died and unfortunately had not tested before, and also Premier Galala also making mention of that recently, saying some of the at-home deaths they've accounted for might also be seen due to COVID-19.